So I went in to see Dr. Kim because I was having these, I had hurt my back from lifting or twisting some with some heavy furniture like 2 years ago, and it got diagnosed as just a back sprain, and so I kept waiting for it to be healed, and every 2 weeks I was having these re-injuries occur where I would be laid out on my back for a couple days and then have this slow recovery again, but no matter what, I had this constant pain along my belt line, my lower back, and down to my tailbone, and it just wouldn't go away. It felt like gravelly, and it was always there, and I just couldn't really figure out what to do. So I ended up doing some physical therapy, and it started to get stronger, and I could tell, and I was excited about that. And then certain things would happen, just lean this way or stand up this way or sit down this way, and I kept having these reoccurring, just felt like re-injuring it. I don't know how to explain it, and I was not able to be at my full functioning for work. I have small kids, and I wasn't able to play on the floor with them, to pick them up, to help my wife, to pick up the house, to do all the little home projects around the house. My social life was interrupted so much. I couldn't sit for that long. I couldn't stand for that long. It was just miserable. So finally, in despair of I just can't do this anymore, Dr. Kim and I talked about this surgery, the LESS surgery, and he gave me the two different options, and I really wanted to do the minimally invasive one. It was really important that I have a quick recovery, not just for my work life, because I manage a bunch of people, but more importantly for my home life. I have 2 small kids, and I can't leave that on my wife, especially with this distance learning stuff going on, and there's not a lot of help around for her, and so then she would be taking care of me plus our 2 kids, and it would just be too much. So my oldest daughter is 8, and this is the age where she's been riding her bike more and wanting to learn to surf, and surfing is a big hobby of mine, and so not being able to share that with her and has been just heartbreaking for me. And knowing that I could be out in the water coaching her and creating those memories, things like that have been the biggest motivation to try to get this back on track. Okay, so I'm sitting in the intra-op or the pre-op room right before going in. I had really good sleep. I wasn't super nervous. I woke up a few times, but was able to go back to sleep fine. I've been counting down the days, and the nurses here have been awesome. And Dr. Kim just FaceTimed my wife, which was super cool. So everything is looking good.
He's been freaking out all morning. Don't believe him. No, I'm kidding. He is unbelievably calm, and he should be, because we're going to take really good care of him.
It's going to be awesome. Looking forward to it.
All right, we have an otherwise young, healthy, active, or previously active entrepreneur that has nagging low back pain, a very, very common problem. It's bad enough to make his daily activities kind of a chore. He barely finishes the day, and afterwards does not have much energy to go out and socialize, do sporting activities over the weekend. And this is a very typical patient that is told, when your pain's bad enough, come back and we'll do a fusion. That's a pretty big surgery with an extensive recovery, and most people don't like the F word, because when a fusion does not go well, it could be significant complications. So this patient has an annular tear that we've confirmed is painful by a diagnostic anesthetic injection. Unfortunately, the pain came back, and if you look really closely, you can clearly see an annular tear there. So most annular tears are asymptomatic, but not all of them. So this person is one of the small group of people whose annular tears are very painful, and for him, the incidence of a painful annular tear is 100%. He has tried numerous other non-operative treatments without improvement. We finally decided to treat this surgically via a laser endoscopic discectomy and annuloplasty. So we will use a small little stab incision in the endoscope, go in intralaminar, and just treat this annular tear. And the idea is the following. Number one, remove the offending agent that keeps stimulating the outer nerve fibers, because when you stand up, the nucleus pressurizes whatever trapped fragments are in there. And then two, if there's any leakage at all, which there is, the body will perceive it as a foreign body and initiate a healing response, which almost always involves the inflammatory process. And for most people, that inflammatory process of healing goes through the normal process and then turns off. But for some people, that process perpetuates in an endless cycle, and you develop chronic inflammatory pain. We see that all the time in tennis elbow, golfer's elbow, plantar fasciitis, shin splints, periostitis, greater trochanteric bursitis, which is really a tendinitis of the hip abductor mechanism. Anyway, the idea is to treat this, restart the healing response, and more likely than not, it will go down the normal pathway, heal, and turn off. And that's the goal. And with this strategy, we've been able to take care of a large group of patients that we've not been able to take care of very well in the past. So, all right, we're getting started. Gowning up. I just scrub my hands like you wouldn't believe, like the outer layer of my epidermis is off. Can I have the little strips? And I'm going to be hermetically sealed. It feels so good. Alrighty, so I've got this skinny little noodle dilator. We call it the Skinny. And I'm using a combination of anatomic technique, intraoperative imaging, and the force, Luke, the force. This is the boring part. I'm just making the opening bigger and bigger and bigger. I still probably couldn't fit my ballpoint pen down that corridor. Already see, there's the nerve. That's the traversing nerve root and dural tube. Look how red and injected it is. Because the inflammatory process is a powerful vasodilator. That's why things get hot and swollen. All right, so I have the disc exposed, and I'm groping it, if you will. And look how incompetent it is already. That should be like a really firm hockey puck. And you can tell there's going to be an empty defect right underneath there. That's where the annular tear is. Look at how injected and inflamed it is. If you don't get better when you wake up, I will eat my hat, because this clearly is caca-poo-poo. Now, this may sound gross, but you know that show, Pimple Popping Doctor? This is the spine version of it. I'm using this cannula as I move medially to release the nerves from the scar tissue, and at the same time pushing down on it, like that pimple popping thing that my daughter has. Laser is awesome because I can work right next to the nerve and it will not conduct electrical impulses, because shocking a nerve is not cool. This is all mechanical. The other cool thing is, so I can get really close to the nerve and not threaten it. And two, it doesn't create a lot of dust, so I can keep seeing what I'm doing as I'm working. Really cute too, Terry. There's one more big piece right there. There it is. Look at that. Oh, I can't wait for you to wake up. Look at that. That's just one of many, 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 many pieces. Alrighty, all done. We're taking out the endoscope. Look how small that is. It's got 3 channels. That's the cannula. It's basically the size of my pen. And the surgery went beautifully. We're all rooting for you, and I fully expect you to get better. So best wishes for a speedy recovery.
Okay, so I'm sitting in my kitchen on a stool that I haven't been able to sit on in months because of my back pain. And this is day 1, about 24 hours after surgery. Had a good night's sleep, and I showered with no issues, replaced the Band-Aid. So far my pain level is about 5, 6 out of 10. And I'm not taking any of the heavy meds. So far today, I've just had a little bit of Tylenol, and overall I'm feeling pretty optimistic. So I'll keep you updated on how the days progress, but so far so good. Okay, so it's day 3 since the surgery, and so far it's going pretty well. My pain today is maybe like a 4 or 5. If I'm laying down, it's like a 1, 2, almost non-existent. I've been managing the pain with Tylenol mostly, or actually that's it, Tylenol, except for at night. And overall, things are going well. I'm not sure exactly what I should and shouldn't be doing, so I'm taking it mostly pretty easy, sitting, laying, putzing around the house a little bit, and that's it. So I'm still optimistic and looking forward to seeing how well this surgery works. Okay, so this is day 5 post-op, and I'm back at work. I came back yesterday for about 5 hours and did pretty well, but just wanted to take it easy just in case. But back at work fine, no issues so far. Pain level today is maybe 2 to 3 just on Tylenol. So all in all, recovering pretty well.